My name is Rex Teeslink. I'm an interventional radiologist. I came to the Medical College of Georgia to start and develop the vascular and interventional radiology program and served as chief of that section for over 35 years. I'd like to thank Dr. Walker for allowing me to be a part of this meeting and to congratulate him and his team for being so flexible in being able to deal with this unusual situation that we've had to deal with this year. What we're going to be discussing this morning is a new technology in access needles. These are my disclosures. Let's take a look at some of the facts referable to needle stick injuries. Between 600 and 800,000 needle stick injuries annually in the United States. There's 1 million needle stick injury annually in Europe. 1/3 of all injuries occur during disposal. 1/3 occur to non-primary users. The CDC estimates that between 62 and 88% of injuries can be prevented. In the US, 50% of all needle sticks are not reported, and physicians are primarily the most likely not to report sticks. Hollow bore needle poses a greater risk for needle stick injury. 25% of hollow bore injuries can be prevented by using a safer needle. $5,000 is the average cost, both direct and indirect, per needle stick in the United States. $1 million is the average cost per case of infection by blood-borne pathogens. An estimated $1 billion annually is saved by preventing needle sticks. In the US, the Needle Stick Safety and Prevention Act of 2000 and the subsequent blood-borne pathogen standard of 2001 require safer needle devices. 5 years post-passage, injuries decreased by 31.6%. However, this litigation did not affect surgical settings, where injuries increased by 6.5% in the same time period. The American Nurses Association came up with a suggested group of rules that everybody should consider in designing and developing a safety needle. We took all of these 10 recommendations into consideration when we designed the safety net. These include the design and activation of the safety mechanism is automatic and will not interfere with normal operating procedures and processes. The device is intuitive and requires no additional steps for use than equivalent standard conventional device. The contaminated non-sterile sharp will be rendered safe prior to removal or exposure to the environment. Activation of the safety mechanism does not require the healthcare worker to undertake any additional steps during normal process protocols providing patient care. Activation of the safety mechanism will not create additional hazards. Activation of the safety mechanism does not cause additional discomfort or harm to the patient. The device will be ergonomically designed for comfort, allowing for automatic one-hand use during all stages of patient procedure. The safer engineering control is available in sizes and iterations appropriate for all areas of use relevant to the patient care needs. Disposal of the safety device will not increase waste disposal volumes, but should incorporate designs to reduce waste. The used safety device will provide convenient disposal and mitigate any risk of reuse or re-exposure to the non-sterile sharp. And as I said, in designing and developing the safety net, we took all these into consideration. The safety net allows access with no change in technique. It's designed to be activated with a single hand, with the free hand having the ability to manipulate the guide wire and control bleeding. The brightly colored housing hub interface gives improved control. The echogenic tip located at the distal end of the needle extends to the bevel tip. There are two bevel up indicators. One is a notch on the hub and 3 raised chevrons on top of the high-vis housing. Patent dual safety guard features are designed to instantly shield the sharp needle tip and trap residual blood within the needle, protecting caregivers from cross-contamination. The safety net comes in 3 different sizes: an 18 gauge 7 centimeter needle, a 21 gauge 7 centimeter needle, and a 21 gauge 4 centimeter needle. I think you can see that the needle is being pulled from the over the guide wire away from the access site, and you can see that you have one hand to control the guide wire and bleeding, and you've got one hand to control the needle. Inside here is the safety guard, and when these release tabs are squeezed, it simply pushes the safety guard via a spring down the guide wire. Again, you can see these 3 chevrons that are raised and the notch here, all indicating that the bevel is up, and these chevrons can be palpated even in a darkened room. As we said, the grip area has been reinforced, and you can see by this reinforcement there's no chance of rotation of the needle. These are the release tabs, so all you do is move your fingers from your access area down to these tabs, and you squeeze them, and the spring pushes the safety guard down. Now, as the safety guard runs down, it's running on the bias of the guide wire. So the hinge trap that is going to trap the needle is actually still up and not engaged. Once it has reached its stop position, as long as it's still on the guide wire, which it is, the trap is still up. But as soon as the needle is removed from the guide wire, you can see that the trap drops in place. This is the entire safety guard, and this portion is the trap that drops in place. Once it drops in place, it covers the needle, prevents the needle stick, and it also creates a reservoir to trap residual blood, so that when you're swinging the needle, or I'm sorry, when you're passing off the needle to the attending, there's no splatter of blood. This is the needle that we're talking about. I have my fingers over the release grip, and you can see that it does exactly what it was designed to do. Also, as we indicated, there's an echogenic tip, and the echogenic tip goes all the way to the tip of the bevel, whereas in competitors that have echogenic tips, there's either a little bead or a small bar here, but it's always on the proximal end of the bevel, so you don't really know where the tip of the needle is. This is important in trying to obtain one-wall sticks on the arterial side, and especially important in trying to access on the venous side. We have access kits in various French sizes that are featuring the safety needle. And we also have PICC line kits of varying French sizes that are featuring the safety needle. I thank you for your attention.